Hello, everyone. It's another Wednesday with your fertility specialist. I'm your host for today's session, Ruth Ogogo, and I'm excited to be with you guys this afternoon. On behalf of Alps Hospitals, I'd love to say a very big thank you to our dear viewers. Thank you for liking our post. Thank you for sharing. Thank you for always staying glued to your screen. As we get started, share this link with someone. Send this link to as many people as you can. If you need to send data, like I would always say, do that right now so someone is able to connect to the session right now. Call up someone if you need to do that, just to remind them it's 3 p.m. and it's time to get some information about the male fertility. Yes, most of the time we're always coming for the women. So today we're here for the men. So all the men, bring your tables closer, bring your chairs close, because we're about to talk about you right now. Well, so we're talking about male fertility and to talk a lot, to say a lot of things, to give us great insight into male fertility today. We have Mr. Stephen Olarinde. Mr. Stephen, it's good to have you.
Thank you for having me once again.
So, for the sake of someone watching, just in case you've never seen Mr. Stephen on this live session before, it might interest you to know that Mr. Stephen is an embryologist. You can go and check your dictionary for the meaning of an embryologist, just in case you're struggling to know what that is. But well, yes, that's his title. He's an embryologist, a very, very smart one of the best, I must say. He's also the head of embryology unit at House Hospital. So right now you are seeing, should I say, let me leave that comment. But right now you are seeing the powerhouse of the IVF lab. You are seeing him right now. So there's just a lot that we will talk about. Keep your questions coming. If you have your brothers, call up your brothers, call up potential fathers, call up your boyfriend so they are able to learn as much. Yes, call up your husband as well. Even if you have children, still call him up. There's something to learn from today's session. Mr. Stephen, it's good to have you.
Thank you for having me
You're
once
welcome.
again.
Okay, so we're talking about male fertility. Once again, viewers, please do not forget to drop your questions, your thoughts, your comments in the comment section, and we'll definitely attend to them. Well, I was checking through and I saw that male infertility. Before now, and when once a couple are trying to conceive, eyes are always looking at the woman, fingers are pointing at the woman. They're like, "What are you waiting for? What's happening?" And then all the village people, the in-laws, is the wife they are pointing fingers. They know they don't point that finger to even their own son, or if it's their brother or not, they just feel it's the woman. And it was surprising to see that about 35 to 50% of fertility issues are actually associated with the male. So I felt it's something that we really should talk about. So men are really informed and they just don't think that every responsibility to preserve fertility actually lies on the woman. So, well, before we talk much about male fertility, when do you really say a man is fertile, or when do you say a man is not fertile?
Okay, thank you.
Mm.
So, you say a man is fertile when he has had sexual intercourse with a fertile woman for a period of 9 to 12 months, and then there's pregnancy. So you
Okay.
say the man is fertile. So when a man has been having intercourse with a fertile woman for this duration and pregnancy is not established,
Yeah.
then you need to probe and know what the
Awesome.
cause of this is.
Oh wow. Okay. So hope you for listening. All men feel like I can impregnate a woman is just to get her down, and and that's what a lot of men actually feel. So maybe we should start knowing today the men that are really not fertile. Maybe so now you as if you know somebody that has been having this, tell the man, check yourself. So you should not just keep pointing fingers at the woman, or shouldn't keep accusing the woman. It's also good for them to check themselves. Well, I've said a little about what global um, examinations or global assessment have actually seen male fertility
Yeah.
to be. What are some of the common myths that or misconceptions that people actually have about male infertility? Yeah.
So the cultural thing has not helped women, and sometimes I'll say the spiritual part, that's the church, where you go for a service and they say those trusting God for the fruit of the womb should come
Mm.
forward. You hardly see men.
Yeah,
How
that's
many men
true.
did you see go out to get the
Very
prayer?
true.
So the bias
I
has
mean,
been there
I
and
really never thought of that.
does not really favor women. But
Yes, that's
globally,
true.
it's been shown that about 45 to 50% of infertility cases is associated with the male fertility.
Hmm.
So it's a cultural thing, it's a cultural bias against women, and it's a societal thing here in Africa.
Hmm.
But I think with education, it's beginning to show that men actually have this problem. And when you look back and you look at the WHO standard for years ago and what we have now, before as at 1992, the WHO standard for the semen parameters for volume, you're looking at 2 mils. For motility, you're looking at 50%.
Hmm.
For the count, you're looking at 20 million per mil.
Hmm.
For morphology, you're looking at 30% or more. That's the reference range in the 90s.
Hmm.
But boil down to 2022, our range is now motility is 42.
Hmm.
Count has dropped from 20 to 15.
Oh, wow.
And morphology, if you're saying, wow, morphology then used to be about 30% or more. Now morphology is about 4%
Are
or
you
more.
kidding me?
So you
Oh.
can see the goalpost has been shifting for men,
Hmm.
showing generally that the male semen quality there's been decline over time due
Hmm.
to maybe different factors that could be responsible for this particular thing. So the society is not doing justice to that. But when
Hmm.
you typically examine a man, it's not I can produce sperm, so I'm fine. I
Hmm.
can perform.
Exactly.
I'm healthy, I'm fine and
Hmm.
big. It's for the when you're talking about the reproductive organs now, the reproductive cells or the that you're talking about, it goes beyond I'm healthy, I'm tall, I'm handsome, I'm
Hmm.
huge.
Hmm.
You could be huge and the condition could be exospemia,
Hmm. Wow.
no sperm. So
At
there are a
all.
lot of myths for men. They think because I can perform, something is coming out. No, it's not just about that. That thing coming out or the sperm, what quality do you have? And
Hmm.
it has even gone beyond just the count, the motility, and everything. What's the functionality of those sperms? Because other factors come into play.
Hmm. Wow.
You could have the numbers, yes. What's the morphology like?
Hmm.
Those morphology, how many are normal?
Hmm.
So those there are a lot of myths. The man feel is healthy, is fine. I don't need to check
Hmm.
her. She's the
Hmm.
one. But baseline test that we do for male is the seminal fluid analysis. We checked and then we know where to go from
Wow.
there.
Wow. Viewers, are you hearing something? So the fact that something is coming out after after you perform is not a guarantee that they are sperm cells.
Sure.
Go and check yourself, young man. Go and check yourself. Don't wait for when you keep your woman in the house and nothing is happening. Right? So yes, I was when you talked about that, I actually thought, a young man might just be wondering that, well, I'm not ready for marriage, and then he feels like he might not even know anything is happening. I was wondering, how do you think young men, or how often do you think they should check themselves? Because it's not something that they really would, for someone that is, should I say, not sexually active per se, or for someone that has not tried to get a woman pregnant, he might not probably know that there's something happening. Are there possible things that some men would see that could actually be a pointer that, okay, it's possible that you might be having issues even if they've not tried to actually get a woman pregnant? Are there possible things?
So, if there's any genetic factor,
Hmm.
for example, maybe those that have Klinefelter syndrome. So, for that, we know the chromosome is 23,
Hmm.
and the 23rd one is responsible for the sex. So, for boys, XY, for girls, XX. So, you're looking at somebody that has the Klinefelter syndrome, a male, instead of having just XY, what that person is having is XXY.
Hmm.
So that is a genetic condition. And definitely with that, there's going to be challenge with production because this is already at genetic level, the cellular level, molecular
Hmm.
level, looking at things. So if there's any presence of mumps, maybe disease condition, mumps, people have
Okay.
that, you downplay them, and then yes, those are
Hmm.
things that can affect your reproduction.
Right. Okay.
Lifestyle, terrible
Okay.
lifestyle,
Hmm.
where there's excessive smoking, alcohol abuse, drinking. All those are also vices that can affect your reproductive lifestyle as a
Hmm.
male. So if you're exposed to all those things, then your work and social cycle.
Yeah.
So environmental factor also contributes. So if you're somebody that works in the paint industry,
Oh. Okay.
works with pesticides,
Hmm.
exposure to all these chemicals and toxins can actually can will affect your
Sperm. Wow.
sexual life. That those that are exposed to saunas, hot
Okay.
baths,
Hmm.
increase in temperature, your laptop and your tie, tight boxers, all
All
those
of
things. Those are
that.
things that actually have a
Hmm.
way of over the long time play a factor in affecting your reproduction,
Hmm.
especially the testes. The testes is something that's very sensitive to temperature. That's how it shrinks and how it
Hmm.
expands and dilates. So an increase in this temperature will definitely affect sperm production and sometimes affects your morphology of the sperms because it
Wow.
can denature them and give them abnormal shapes.
Wow. So, viewers, I hope you are learning. And for someone watching, you might just be wondering. So, for based on your experience over time, do you think that as a young guy, it's not a bad idea if they actually check themselves, even if it's yearly, or just that's if they are not at risk of anything?
Yes, over cancer, like cancer is another disease condition that we didn't mention. If you have this, you can check. But I think it's not bad for a man to just walk in to have a seminal fluid analysis to check.
Hmm.
Um, Incidentally, years ago, a man walked into our facility for
Okay.
to check his sperms.
Okay.
So I think he did it somewhere and he was not really understanding.
Wow.
So somebody asked him to reach out to me. So he reached out to me, we checked. And then after checking, everything was fine. So I encouraged him. I told him, just healthy lifestyle, live your life,
Yeah.
everything will be fine. About 3 weeks ago, his daughter was admitted in the hospital.
Okay.
I totally forgot, didn't remember.
Hmm.
It was at the point of discharge that I saw him, we just greeted, and he looked
Yeah.
at me and said, "You didn't remember me?" And I'm like,
Hmm.
"Okay, sorry, I can't." Said I should look at him closely. I said, "I think I've seen the face, but I can't remember." So he told me then he was the one that came for SFA years ago,
Hmm.
was
Wow.
planning to marry.
Wow.
I told him everything is fine, he should relax, and this
This
is
is the
the
product.
product being admitted in our hospital.
Wow.
So I think there's no harm in checking to know your
Mm.
status. So from there, I think you know what your available options are, and then
Uh,
when you're settling into the marriage life, you don't waste time to explore those options.
wow. So viewers, this is a wake up call to every man watching or to every lady watching right now. So you could also inform every man in your life, whether your brother or should I say your father now, because your father has fathered you. Well, yes, this is a wake up call that we shouldn't forget or just leave anyhow.
No need to stress.
There's a place of male fertility, and it plays a lot of role in fertility as a whole, and you cannot overemphasize the
Yeah.
need to keep checking yourself, or once you're at risk you can't emphasize the need to work on your lifestyle like Mr. Steve has actually told us. Okay, so I know you talked about lifestyle. I was also going to ask what the possible, because we have this notion that women are the ones that enter into menopause, and that as long as a man is, no matter how old a man is, he can
Can still
impregnate. You
produce.
hear 70-year-old married a 20-year-old and she's pregnant and all of that, and then so we feel like the male is always fertile. Well, do you really think that age actually impacts the male fertility?
Yeah, age impacts the male fertility, but not like that of the women, for
Okay.
example, because for the men it's more further. For a woman, it can be premature.
Hmm.
That is, she could still be very young and have what we call premature ovarian failure. That's
Yeah.
affecting her. For the women, it's a complex system where you're not just looking at just one particular gamete. For the woman, you're looking at her endometrium, the lining of the womb, to see whether it's fine, the tubes are fine, is there hormonal balance. But for the male, it's just strict basically to the semen. So age actually plays a factor too, but much later in age. Some from 40 to 45, some more maybe from 50. But basically, what it does for men is to reduce the volume.
Okay.
The volume of sperms produced will be less compared to when it's younger. The motility less, and the morphology too, quality of good sperms that you have will be less at that age. So it's common that yes, the sperm will be fine. They have a baby, but because of different exposure of the man to different things,
Yeah.
some mutation may have occurred, and then sperm production is affected. So the quality of the offspring being brought may
Hmm.
be a challenge in
Hmm.
that this thing. Yes,
Hmm.
because the younger they are, the healthier and viable the sperms are compared to when they are more advanced in age and older. So yes, age play a factor in men, but not as much as in women.
Okay, so I hope someone shall, because all those men that say they are going to school and they are waiting till they are 50 before they get married. The quality of the children you are bringing is questionable. Well, that's on a lighter note, but now on a more serious note, they usually would say that a woman's fertility declines once she's about 35. It
Mm.
declines, and then as it goes, I think I've also heard or I've seen this talk about the quality of it's the way they would say a woman gives birth when she's at 35, the child is at risk of congenital
Yes,
abnormality.
abnormality.
I
Yes,
think I
because
also
of
saw something like that about the male too, that from age 35 they are also at risk. The woman could be young, but if a man is over 35, it's also possible that
yes,
they could also give birth to offspring. So it means that, yes, as much as we're saying the age of a woman has an impact on fertility, it's also same for the man. It's
man.
just that,
Yes,
yes, the man must still be able to get a woman pregnant, and for a woman, she might start struggling
yeah,
with
to achieve
pregnancy after 35.
pregnancy. Yeah,
But like he has said, the quality, and I know that the goal of giving birth to a child, you want a child that's healthy,
yeah, healthy
that's
child.
that's that's performing optimally, and not a child that becomes a burden to you as a parent. And that's why, even as a man, yes, as much as we know that most men, or some men, let me not say most men, some men would wait till they're over 35 before they start considering. They'll say they want to make it in life before before they consider sorry, before they consider settling down, or and all of that. But it's good that you're knowing that it's possible for you to have um, um babies with abnormalities even after
After, yeah,
35.
that's
That's because
burden
of
the
the quality.
society and the government
And
places
well,
on that.
it's just the environment we find ourselves
Yeah,
in today, and
society and the
those
government.
things.
Yeah.
Okay, so Adia, well, let's even ask, let's, because we talked about people checking. How do you see that they just you just come to meet the doctor? Just the way a woman will go, that I want to check myself. How does a man get to check himself to know that he's not having any issues? Because, for instance, a man that is struggling with erection, he will start questioning himself that there's
Yes.
something
You're
wrong.
wrong. Yes,
Yes.
exactly. That's actually a challenge to your.
But for someone that anytime you say arise, it
Yes,
arises, he might not feel like there's any issue.
but
So
there's more
how
to
do
the
they,
arise
yeah,
than
so
just
that's so,
arise.
so how do they really check, or what
So
do they know? How do they know that they have issues with their sperm? Yes, how do they
so
know?
baseline seminal fluid analysis. That's what
Oh,
I request
okay.
for.
Okay.
Other tests can come in after that, but that's like the baseline where they're looking at vitality.
Mm.
That's the number of sperms that's living alive, because there are some people that have the condition we call necrosospemia.
Okay.
So every sperm they produce is dead.
Hmm.
Yes. Or let me say most of the sperm they produce is as it's coming out, you expect lifespans, but they are dead.
Hmm.
Some global zoospermia, that's a morphology issue where the sperm, instead of the head being oval, it's round.
Hmm.
And then there's a problem with the acrosome.
Hmm.
And the acrosome plays a very important role in fertilization, because there's something we call acrosomal reaction. That's
Okay.
what happens before the sperm fuses with the egg to give
Okay.
syngamy.
Hmm.
So some people have that condition where it's like the sperm head is just big and
Hmm.
there's nothing inside there.
Inside. Wow.
So seminal fluid analysis gives you a true picture of
Oh.
what's happening. So for
Okay.
seminal fluid analysis, you're looking at the motility. That's the number of sperms moving. They're not
Mm.
the ones that are rapidly moving, the one that's sluggishly moving, and the one that are
Okay.
just non-progressive in a place.
Mm.
So you're also looking at the morphology. That's the normal sperms from the abnormal sperms. What's the head like? Like the globus of sperm that
Mm.
I say is round. Some could be amorphous, some could be pin-like. So you're looking at how normal the sperms is. So you're looking at the head,
Mm.
the midpiece, and the tail, how the normal that is. Then another one that much emphasis is played on is the count. That's how
Mm.
many do you have? Are they in 20 of millions? Is it less than that? So basically, the SFA gives you a picture of what the sperm is like. And when you walk in any facility, you said you want to do SFA, normally they tells you to abstain for 2 or 3 days. You
Okay.
produce the sperm, and the sperm is being analyzed based on these three basic the vitality, motility, morphology, and the count. And
Mm.
in some cases, DFI may be requested after that particular, but that is like an advanced form of analysis after you've done the SFA, because you need the SFA to know what the problem is, then
Mm.
you know what's next form of action
Sure.
or remedy is for that person.
Hmm, wow. So, viewers, hope we know now how to check to know if something is okay or if your sperm is fine. You would see them at the lab. Just in case you're confused, you can actually come and ask of Mr. Stephen Alps Hospitals. But that's on a lighter note. But if you really have not really understood how to check, this is a baseline that has given to us. You walk into a good lab, not just
Yeah, good lab,
anyhow lab.
a good
Yes,
lab, yeah.
a good lab.
Seminal fluid analysis.
Because there are some people. I think it's even best if you actually go to a lab that's are fertility inclined, because it seems like
Yes,
these days
it makes it
some
easier.
some
Yeah,
of this lab you really cannot understand what they read and tell people
people. Yeah,
sometimes. And then maybe somebody tells you that they did this test just maybe 1 month ago,
yes,
and then by
and
the following month you are not understanding. I mean, do
yeah,
you have
we
incidences
have
like
those
that?
challenges where people walk in with SFA results.
Hmm.
Sometimes for those that are long in the field, you see those counts, you know it's not
Hmm.
possible. Maybe
Wow.
an angel, if it's possible, may
Hmm.
have that kind of SFA. That's
An
if they have
angel.
that. Yes, they're working with very ridiculous numbers.
Wow.
And then when you look at it, and when we do the analysis, it's not
You
really
can't relate
tying.
it.
And then the question is, okay, if the sperm was this, that means your condition is fine. Then uh,
Suddenly.
why is there no pregnancy? Because if
Exactly.
because you're telling me your sperm is fine, we check the woman, she's fine.
Hmm.
You're bringing a sperm of over 100 million
Hmm.
counts, and I'm like, wow, this is impressive. This is good.
Hmm.
So why are we still having challenges with
Pregnancy.
achieving pregnancy? Yes,
Hmm.
there are some cases where there's unexplained fertility, but ridiculous count. And when you do your analysis anywhere, it should, if it's not the same thing, close something that
Close.
makes clinical sense. So
Hmm.
yes, we experience that. We sit them down, we counsel them, and in some cases we even show them images of what a good sperm look like and
Hmm.
what their own is,
Is
so they can compare. So by the
it's
time
true.
you come in, I show you, okay, this is a sperm that has maybe 20 million or 20 million, by the way.
Hmm.
Let's say
Wow.
let's say
Hmm.
10 million or 18 million or 15 million,
Hmm.
15 million, and then yours is maybe like 3 million.
Hmm.
So when I show you the count, like, okay, this premium I'm having is 15 million. This is your own. Can you see it? This is 3
Hmm.
million. You can see the difference. So
Yes.
sometimes it takes that level because some men can be, us now, the ego and everything. So it
Yes.
takes that
Difficult to
to bring
accept.
that to that level to explain to them that, okay, this result is not actually tying up. So yes, we get that.
So we actually have a lot of laboratory errors coming from the lab. Sometimes we can't even count the number of times that genotype mismatch and all of that have
Yeah.
happened. And that is why, viewers, it is important that you actually go to a very good and reliable lab. A very good and reliable lab. I'm emphasizing on that, where you could, to a very large extent. Yes, we're not saying that these errors are inevitable,
Yeah.
but to a very large extent, the errors are very minimal and very minute. So I hope that you're able to check yourself as a man in a place where you can, to a very large extent, get results, and hopefully get whatever result it is that you're hoping to get. Okay, so I would ask this last question. Sometimes you have some couple that might be battling with miscarriage, and then maybe, just maybe, the woman's part, and
No, she's fine.
they've checked that she's fine. Yes, it's not their problem is not probably, maybe she's actually they're achieving pregnancy. And then for the man, what extra tests do you think they want to do? Because now the problem is not that they are not achieving pregnancy, and on the woman's side they've done the clinical
And
checks they
she's
need to
fine.
check, and she's
So
fine. And
that's
then,
where the advanced test comes in. You do
oh,
the
okay,
DNA fragmentation index,
oh,
DFI
okay,
test for the sperm.
mm,
So the DFI identify the sperms with normal genetic materials. That's This sperm is complete.
okay,
Everything, acrosome is there, the
mm,
midpiece is fine, tail is the length is normal, everything is fine. So that's where the DNA DFI comes in.
yes,
Most people don't do this practice; they just leave to chance and everything. But most times it's good to check because the what we could be struggling with could be high DNA fragmentation with demand,
mm,
and
oh
there could be
wow,
some need to do some lifestyle modification, probably
okay,
place him on some supplements to mop up
mm,
oxidative stress that can affect these sperms, or more importantly, explore the field of assisted reproduction,
okay,
where these sperms can be prepared,
mm,
selected, and used for treatment. So most times when this condition, DFI is the first point, you do this to
mm,
see how many of these sperms that you say you have is okay.
mm,
Now remember, the morphology tells us how many appears fine,
okay,
irrespective of the count. Now the
okay,
DFI goes to the sperms
mm,
genetically to identify that this sperm is normal.
okay,
The acrosome or the genetic material here is
yes,
complete. There's no
mm,
any translocation or anything there. So you can see it's deeper. The analysis
yes,
is what you're seeing, it appears like. The DFI goes deep to analyze these sperms individually for their
mm,
genetic material. So DFI, it is important to check the DFI from there. And whatever the result is, then options can be
good.
given to the couples for them to
Mm.
explore so that they can achieve pregnancies.
Wow. So viewers, we are also learning something new. We've learned DFI. So there's a lot to talk about the male fertility. This is just part A of male fertility. We have something more interesting coming your way on Friday. So you really do not want to miss our live session on Friday. Mr. Steve is going to pieces everything about the sperm. Like anything you want to know about the sperm, like he's going to give us so much insight into sperm and all you need to know about male fertility. There's a lot he will talk about. I know that you've actually learned a lot from today, and I've also had I've learned something from today. And you can imagine how much more we would have to get from him. A lot. I wouldn't want to tell you everything, so you'll be curious to know what we have coming your way on Friday. But I look forward to seeing you all and even more of you on Friday because he has something more interesting for you on Friday regarding male fertility. So keep yourself attentive and just watch out for Friday's episode. Mr. Steve, it was good to have you today.
Thank you,
Thank you
Ashley.
so much for all you've talked about regarding male fertility. And yes, for the women, we've not forgotten you. Don't worry, we'll come your way sometime. But for now, the men stay put. We'll see you on Friday. Bye for now.